Have any of you ever experienced unexplained pain to your feet? Maybe some warmth, redness. Maybe you're waking up in the middle of the night and the sheets are causing an incredible and excruciating amount of pain. Well, my friend, you might have gout. So I'm happy that you tuned in so we can talk all things gout. So let's get into it. Gout is a type of inflammatory arthritis that typically affects your big toe, but all joints can be affected. Essentially, people get gout because they have too much uric acid in their body. Uric acid can accumulate if you have a genetic predisposition to just not get rid of some of the uric acid, or it can be caused by certain types of food that you're eating. If you are a fan of red wine and steak, if you happen to work at a brewery, if you like beer and you're testing it all the time, gout could probably be in your future as well. But essentially, gout is very painful, and sometimes it can last up to a week if you don't have any treatments. Sometimes people can even have an inability to walk because gout is so painful. So, if this is affecting you, some things can be done. The first thing that you need to have is a good diagnosis. Sometimes people will go to the hospital and get a uric acid level, and the level will still not be elevated, but sometimes it's necessary to get a repeat uric acid level up to 2 weeks after you actually have the gouty attack. This will give you a normal baseline of where your uric acid levels are normally, and then we can kind of see if we need to be concerned. The gold standard of diagnosis of having gout is actually uric acid crystals that form in the joints. These crystals actually have to be aspirated or taken out of the joint. So everything dietary can be managed in moderation, and maybe that's all you need is a dietary restriction. But sometimes people need medication in order to prevent gout. There are acute medications that we can provide that can help you get rid of the abnormal and excruciating pain right now. For an acute medication to take hold, it usually requires about a week's worth of treatment. You can actually start to feel better in a day with the acute medication and hopefully back to your normal self in about a week. But if it lasts longer, you want to definitely go see your doctor to discuss your other treatment or diagnosis probabilities, because usually gout will last a week. But if it lasts longer, you could be flirting with another type of infection. And there's other medications that if you have what's called chronic gout or repeated episodes of a gouty attack, that you might want to consider being placed on a preventative medication in order for your diet to be helped and for your body to excrete more uric acid, so that way there's not an accumulation or a buildup of that uric acid. But the biggest thing we need to do is get a good diagnosis. Now, gout is not something that you want to just get through by taking a bunch of ibuprofen or any type of anti-inflammatory medication that you have lying around the house, because it can be detrimental to your joints specifically. If you have repetitive bouts of gout, you can experience joint destruction. It can be seen on an x-ray. You can see the cloud of crystals that form around the joints. You can see little areas of where your bones can be taken out. And then that's actually problematic, because now it's just the way that your joint is and your joint's not functioning properly. And that's when you can have consistent and chronic pain. Now, let's say that you already are in that position. Maybe you have chronic gout that has gone untreated for a very long time. What you can do is come to your podiatrist. If you want, you can come see me at OC Podiatry in Long Beach, shameless plug, and then we can discuss your treatment options. Now, there are non-surgical options that we can discuss, and we can continue to work with a rheumatologist in order to give you a good non-surgical treatment option. But if surgery is inevitable, namely fusing the joint would be the best decision for you. If your big toe joint is fused, there's no joint to have those crystals settle into and cause more joint destruction. But like I always say, preventative medicine is the best medicine. Well, you guys, I hope you learned a lot about gout. It's one of those kind of conditions that you really don't know it unless you have it. But once you have this diagnosis, it makes all the sense in the world. If you have any more questions, don't forget, call your local podiatrist or call me at OC Podiatry in Long Beach. And don't forget to like, subscribe, turn on your notifications so that next time you know when I post a video, and I will see you next time. Bye.